My name is Timothy Donahue. I am the Chief of Surgical Oncology and a Professor of Surgery at the David Geffen School of Medicine at UCLA and UCLA Health. So the question is there a role for regional lymphadenectomy during pancreatic surgery? The answer is yes, regional lymphadenectomy, but I wouldn't say an extended regional lymphadenectomy. Pancreatic cancer has a very high predilection for metastases even during early stages of tumor initiation. If you look at all comers, patients with pancreatic cancer who undergo surgical resection up front, about 75+% of them will have node positive disease when it is removed. And that's even the earliest stages of patients, at least anatomically, who are eligible for surgical resection up front. The NCCN, the AJCC recently changed the staging criteria for pancreatic cancer to not only have an N0 versus N1 disease, but there's N0, N1, and N2 disease. Now with N2 being, I think, 3 or more lymph nodes that are positive. A more of a lymphadenectomy in patients or for these cancers can better stage patients and have yield more prognostic information for them. There's good data out there, retrospective data in the surgical series out there to show that at least 12 to 15 lymph nodes should be harvested in order to fully stage patients. That's mainly what the old AJCC staging system. I'm not sure if that holds true for both the N1 and the N2 disease, but as surgeons, I think we try to get out at least 20 or 25 lymph nodes to fully stage patients with pancreatic cancer. There's a lot of literature in Japan that's looked at extended lymphadenectomies for patients with pancreatic cancer. Whether that be going high up in the porta hepatis to dissect lymph nodes, or for head tumors, or to remove these nodes between the aorta and inferior vena cava, those aortocaval nodes, for full staging. And to my knowledge, none of that has really panned out in terms of offering a survival benefit or changing. Really, I said offering a survival benefit. Like the case with gastric cancer, where I think the story is a little bit more solid with a D2 lymphadenectomy or an extended lymphadenectomy, offering a survival benefit versus just a smaller regional lymphadenectomy. So all in all, yes, the goal is to get out about 20 to 25 lymph nodes or so, ideally for pancreatic cancers. Those are all regional lymph nodes. Most patients wind up having positive lymph nodes, especially those patients who are treatment naive, but less of a benefit for an extended lymphadenectomy for pancreatic cancers than other GI malignancies.